Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is how to non-operatively treat sciatica. What exactly is sciatica? It's pain that occurs in a person's leg due to a pinched nerve, usually from a herniated disc. Now, the sciatic nerve is actually a conglomeration of three nerve roots, L4, L5, and S1. As they come out of the spine, they come together and they go down the back of one's leg as the sciatic nerve. If one of these nerve roots is pinched as it leaves the spine, it causes sciatica with resulting symptoms related to, which nerve root it was. 1% of the population suffers from sciatica at any one point in time. The symptoms you experience are going to depend on which nerve root is getting pinched. Usually it's L4, L5 is the level of the disc herniation that comes out. L5, S1 is the second most common. But together they make up about 90% of the ones. And here's what happens. Here's the front, here's the back, here's the disc. Piece of disc comes out, pushes on the nerve root, inflammation sparks up, and you get pain known as sciatica. It could be a burning, searing type of pain, a tingling sensation with pins and needles, cramping, numbness, weakness. Now, it's diagnosed by either history and physical. MRI is excellent, such as you see here. You can see a huge disc herniation coming out the back, and then a nerve conduction study can help as well. This is called the straight leg raise test. So the patient lays down, the doctor lifts up the leg straight, and it causes tension on the nerve root, and pain will shoot down the leg, usually if there's a disc herniation with sciatica. And when the leg is bent, it takes tension off the nerve root and the pain goes away. So here's the typical dermatome. So L4, L5 will usually pinch on the L5 nerve root. So a person often has pain that goes down the outside of the thigh and kind of wraps around the front of the calf. If it's L5, S1, it's usually pain. This is the back of the leg. So if it's L5, S1, it usually pinches on the S1 nerve root, so you get pain down the back of the leg and down the back of the calf. But, most patients don't step right out of a textbook. So muscle weakness is more concerning than just having numbness. It's unclear how long you can watch muscle weakness until it becomes irreversible. So you can say, well, we can watch it for a while, 3-6 weeks, and see if it gets better. If it doesn't, consideration should be given for surgery. Watching it 3, 6, 9 months, it may never get better, even with a great surgery. So you can end up getting difficulty with flexing your hip, flexing your knee, lifting up your foot. It just depends on which nerve root is being pinched. Non-operative treatments for sciatica, there's quite a few of them actually. Over-the-counter medications, anti-inflammatory, Tylenol. A Medrol dose pack is a large dose of prednisone for a few days. Narcotics, muscle relaxers in the short term. Neuropathic medications such as Lyrica, Neurontin, and even topical prescription pain medications can help. Physical therapy and chiropractic treatment can be great for pain relief. This is spinal decompression therapy, which is computerized intermittent traction, which can help relieve sciatica as well. When it gets to interventional treatments, trigger point injections can be great for relieving aches and spasms. Epidural injections, such as you see here, where steroid medication is put right around where the nerve root's getting pinched. It bathes it with soothing steroid. That can be done as a series of 3 injections and repeated every few months as necessary. This doesn't fix the problem, but the hope is that it will give pain relief while this piece of disc degenerates. They're anywhere from 75 to 90% effective for relieving pain. 80% of those with sciatica recover within 6 weeks, 90% recover within 6 months. Studies have shown that the outcomes at 1 year are identical between those who have surgery and those who don't. And those who don't, this actually says you are leaving pain. So don't enjoy the journey of pain. So symptoms to watch for include muscle weakness. As I said, you shouldn't watch that forever. Incontinence, that's a surgical emergency. And then if your symptoms are getting worse rather than better, that's something to give consideration to. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are several clinics throughout the Mid-Atlantic region accepting over 50 insurances and providing over 25 treatment options. Very high success rates with the board-certified award-winning doctors. So visit us online at midatlanticpainnetwork.com and then call us for more information and scheduling at 855-444-6585. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.